Hi, this is Courtney with PRMA Plastic Surgery, and I am here with our nurse, Crystal Yang, and we are going to be talking about nipple reconstruction and specifically 3D nipple tattooing. So thank you so much, Crystal, for taking the time to chat with us today. And can you briefly walk us through what the options are for nipple reconstruction after a mastectomy?
Sure. So at our second stage of reconstruction, most patients are candidates for nipple recon. Every now and then we have a patient who's not a good candidate, and maybe 3D tattooing would be a good option for them, which we'll touch base on in a bit. But our surgeons here typically use the bow tie method for nipple reconstruction, which is using the same skin that you already have to your breast after the initial reconstruction. They do like fancy origami. They use dissolvable sutures, and you're left with a little nipple nub.
What are the options for nipple tattooing? There's the micropigmentation that you talked about, and then there's also the 3D options. Can you talk to us about the differences between the two?
Sure. So for patients who, for example, opt out of nipple reconstruction, there's special tattooing techniques where we can use shading and use a variety of different colors to offer dimension and give you the illusion of a nipple bud with some projection with the shading that we use. We can even use that technique if you have had nipple reconstruction, just to optimize on the reconstructed nipple. Or, you know, some other older methods of tattooing is just using one flat color throughout. So that's also an option, but the 3D, the newer techniques are really nice. Gives more dimension.
And is there special training that's involved in order to provide patients the 3D tattoo option?
So myself and one of the other nurses here at PRMA, we were sent to be trained by a tattoo artist. So yes, there is special training. You do require certification to be able to offer 3D tattooing.
Okay. And when can nipple tattooing be performed?
So we suggest at the soonest that you wait 3 months after your nipple reconstruction. Keep in mind, 3 months, we want to make sure there's no scabbing, no residual sutures to the reconstructed nipple or to any of the surrounding scars. We want the scar to fully be mature before we start tattooing that area so that the pigment absorbs well. So you, at the earliest 3 months, but the longer you can wait, the better.
And what about for patients who opt to not have the nipple reconstruction? Is there a certain time period that we recommend them to get the tattoo?
Then I would still wait the 3 months after their second stage of reconstruction so that all the surrounding scar tissue would be fully healed over if there's any scars in that site.
So are the nipple areola tattoos a permanent option, or is it something that patients will have to get touched up over time?
So with the current technique that we're using, the tattoos tend to last anywhere from 3 to 6 years, depending. We do offer touch-ups. So if you ever feel like it's patchy or you want more color, we can always build the color. We do offer one touch-up. But just like any other tattoo that you may get, touch-ups are typically required for tattoos because they do fade with time.
Okay. And for patients who opt to not have nipple reconstruction or maybe not even have the nipple areola tattooing done, are there other alternative options they can consider?
Yeah, you can have fun with your reconstruction. Some patients opt to get the breast cancer pink ribbon where the nipple used to be. Some people get butterflies, a large tattoo over their whole chest wall. Whatever works for you, have fun with it.
Okay, thank you so much, Crystal, for taking the time to talk to us today. If you've watched this video and you have questions or comments about the 3D nipple tattooing, please leave us a message in the comments below. Thanks so much.